Did you have an appointment with us today? You did? Okay, what was your name? Let me just check you in on my computer over here. And your last name, please? Okay. So, and what time did you say that was for? You said 8:30? Okay. So your last name and then first name. Alright, I see you here up on the system. It says we have you in for a cranial nerve exam and a diabetic exam as well, because you have diabetes. Okay, well that's not a thing to be ashamed about. You know, we're all just human, and we all have doctor visits from time to time. So yeah, that's not a problem. We can get you in right away. So the doctor is running a little bit behind, but I will rest assure you, you are the next patient. Okay? So, let me just run some notes down for the doctor, and he will be right with you. Be right a minute. How is your day today going? In your New Year's? Are you having a good day at New Year's? You are? Okay, I'm glad to hear. I'm very glad to hear. Yeah, it's not been too busy here at the office, but you know, we do have those emergencies where people come in for little emergencies, big emergencies, things like that, and we try to get them in and out as soon as possible. That way they can get back to their families and enjoy being at home instead of being inside the hospital. So, yeah, we do hear from a lot of people coming in with that type of issue, but there's nothing to be worried about. Okay. The doctor will see you now. Okay. Hi, I'm the doctor. I'm going to be getting you checked in and getting everything situated for you. I do have my tools and everything I'm going to be checking right here on the side table or next to me. So let's get started. Make sure everything's all set. I'm going to start with checking your blood pressure. And don't worry, this isn't going to hurt or anything. I'm just going to be checking your blood pressure and your heart rate and your lungs and heart rate and everything else inside. Thanks. So just no talking and just sit there, relax, and everything's going to be A-okay. Okay. Breathe in. And breathe out. Breathe in. Breathe out. Okay. Sorry, it's kind of hard to hear with that in my ears. Can I have you spin around so I can hear the back side of your chest or your back so I can hear your lungs a little bit better? Okay, thank you. Good job. You know, I'm not hearing anything that you need to be worried about, but there is some little misbreathing here and there, but like I said, it's nothing to be worried about. We can get that checked in for you and situated and resolved. So, I am going to let you know that my hands are clean. I just pre-washed them and used hand sanitizer, but I just want to let you know that my hands are clean and sanitized for this. So there's no need to worry. Can I have you open up your mouth, please? Because I'm going to look inside your mouth and make sure there's nothing that I need to be concerned about. Okay? Just open your mouth for right now and say aw. Aw. Okay. Let me get around on the other side real quick. let me get a little bit closer look here for you. I need to get some light real quick. Alright, and just say all one more time. You know, I'm not seeing everything there looks fine to me. I'm not seeing any kind of redness. Everything looks pink and moist the way it should be. Okay. Now I would like to just write some notes down on some things I've just seen, but don't worry, there's nothing to be worried about. It's just for my practice and for the intern that we have sometimes, so that way they can go over their notes and see kind of what they're learning. So just give me one moment, please. Yep, how was your day? Other than the sore throat? Okay. Yeah, my day's been pretty good so far. Thank you for asking. I'm sorry to hear about that, but don't worry, we'll get you all situated and get that checked out for you. Okay, so now what I would like to do is get my little handy bag out, and I will show you the devices and tools that I will be using. So this is the bag. So just give me 1 second, I'm going to unzip it and I will show you what's inside. That way you're not surprised by anything, and that way you're fully aware of what's going to be happening. Because I just know that when I go to the doctor's office, I like to be known as well. That way they know and I know, and that way we're all on the same page. So I would like to get your oxygen levels from your finger. And I'm just going to be using this little device. It just kind of goes on your finger for a few seconds, at least a minute. And it's going to check the oxygen levels in your blood. So just stick out your finger just like that, and I will put this on. Let me just turn it on for you. Okay, there we go. Alright, now while that's going, I will be checking your temperature. So if that's okay, I'm going to check your temperature. Give it a second. And just hold out your mouth. Yeah, you don't need to speak. That's okay. So it's saying it's normal, so that's good. You don't have a temperature, or at least your temperature is not as high as it would be if you were sick. The other thing I'm going to be doing is, since you did say you are diabetic, I'm going to check the blood, and with this is what I'm going to be using. I'm sure you have one at home, and I'm sure you've done this all before, so it's just going to be a little prick. Nothing too scary. So let me check the oxygen in your blood. Yep. Okay. And let me check your other finger real quick. Alright, that's all good. So your oxygen level is normal, which is good. And let me go ahead and check your blood rate, your heart rate on your on your arm. So I would like you to just hold out your arm just like that. Okay. And if you have a sleeve, just kind of roll it up a little bit so I can get your arm. You can get your blood pressure as well. Yeah, that Velcro is kind of new, so I'm sorry. Just hold out your arm for me, please. Thank you. And now, let me just wrap that around. Now let me hook it up. now just take deep breaths in. Like I said, there's no need to talk, there's no need to speak. Just sit there, relax, and it's going to be okay. Here we go. Yeah, that's normal. The puffing up of the cuff. That's normal. Don't worry. So now I'm gonna be checking your blood levels and for your So we don't need this anymore. Put that down. So now I'm gonna sanitize your thumb or your index finger, whichever one you want me to do. I just need to get this little tool out real quick. Okay. So we got that right there. Let me get the measuring device. So this is the measuring device that we're going to be using today. Alright, that's good. That's working good there. And then this here is just a little device. It's going to allow me to draw some blood, but don't worry, there's no needle. As you can see, there's no needle. It's just a little loaded like that. Here, let me show you. So I don't know if you've done one of these before, but this right here is very simple. Like I said, it's not gonna hurt that much. Just a little prick. And it's just like getting your flu shot or anything else. Or it's like a little mosquito bite. Just think of it as like a little mosquito bite. You won't even feel it. But you just use this. You go like that. You hear it. You put it on your thumb or your finger, and then you push the button. But like I said, there's no needle, so there's nothing to be worried about. It's barely just a barely little pinprick. That's all it is. So I'm gonna go ahead and get that loaded for you, and I'm going to sanitize your thumb. That should be good. Alright, I'm gonna count on the count of 3. I'm gonna use, like I said, this, and then I'm gonna use these little test strips to get the collect your blood, and it'll read the levels in this machine here. Okay, on the count of 3. 1, 2. Yeah, you see, I did it before I said 3, just that way we can get it over with. Because the longer you wait, the worse it gets. I know. I have to get my blood drawn, and flu shots, I feel like I'm a human experiment. Just saying. But test experiment, I should say. So, let me go ahead and collect your blood. I'm just going to remove that. And let me just draw up some blood here. There we go. Okay. And it's reading normal, so that's perfectly fine. I'll be right back. Let me wash my hands, and I'll be right back with you. Alright, so I am back from washing my hands because I do not want any kind of biohazard things on my body or on my hands. So my hands are now clean, they're sterile, and it looks like everything checks out. Would you like to schedule your next appointment? You got a little bit of a headache from that needle. I think I can help you out with that. So I'm gonna give you at least 2 of these. That way you can have one now and one later. And these are just some non-aspirin PMs. So if you can call somebody to come pick you up, that would be beneficial for you. That way you don't get drowsy and whatnot. But I will be giving you 2 of these to use, one for now and one for when you get home, because I know you drove about an hour away to get here, but that's perfectly fine. So let me get you some water. And I'm gonna get the water for you here. Alright, let me just put that down for you. And then go ahead and open up, and here's the pill. Don't worry, it's not that big of a pill, so. Alright, I'll just put this in here for you. Okay, and drink. Alright. So, that's gonna take about, give it about an hour, and your headache should be going away pretty soon. Like I said, I will give you one of these to help with that headache for later, because you will be needing it. But you would like to schedule your next appointment? I can do that right here for you. Yep. Okay. Do you have a time and day of preference? Do you want the same time, same day, or we can, I mean, my schedule is pretty wide open right now. So you want, let's see, I have a Friday. We're closed on the weekends, so you can't do that obviously, but we have Fridays, Monday all next week, and Thursday of all next week. You want Friday the 10th? The 9th. Yes, the 9th. So, that day is a special holiday. We can't really take in people on that day, but we can do the next day, which will be the 12th. You want to go ahead and schedule that for Monday? Okay, let me get you scheduled in here. And what time did you say? You can do like 9:30? Okay. So it looks like we've got you scheduled in for 9:30 on Monday the 12th. And we hope to see you soon. If you need to cancel or reschedule, just go ahead and call the office and we'll get that situated for you. Thanks, and have a nice day.